Hello everyone. This presentation is on Zhen Wu Tang, also called True Warrior Decoction. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Zhen Wu Tang is classified under expel dampness. A representative pattern is spleen and kidney yang deficiency with water retention, dizziness, edema and scanty urine. Important ingredients include Fu Zai, Fu Ling, Bai Zhu, Bai Shao, Sheng Jiang. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 72-year-old man with heart failure and chronic kidney disease. The current medicines are furosemide, carvedilol, amiodarone. This case gives a plausible reason to consider Zhen Wu Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Fu Zai plus antiarrhythmic drugs. The mechanism is aconite alkaloids can affect cardiac sodium channels and provoke ventricular arrhythmias if inadequately processed or overdosed. The clinical significance is potentially life-threatening with amiodarone or structural heart disease. My management plan is only use correctly processed food under expert supervision. Avoid if arrhythmia risk is high. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is diuretic herbs plus furosemide. The mechanism is Fu Ling and Bai Zhu may add to diuretic effects. The clinical significance is moderate due to dehydration and electrolyte shifts. My management plan is monitor blood pressure, weight, kidney function, and electrolytes. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Sheng Jiang plus antithrombotics. The mechanism is ginger may have mild antiplatelet activity. The clinical significance is usually low, but increases with multiple bleeding risk agents. My management plan is monitor for bruising and avoid high-dose ginger supplements. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Zhen Wu Tang may be reasonable when the patient's presentation matches spleen and kidney yang deficiency with water retention, dizziness, edema and scanty urine. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.